Thank you for those updates, Governor. Today I'm going to give a brief overview of where things stand with our vaccination efforts. I'm incredibly pleased to report that this has been an enormously successful first week in terms of vaccination. We're in an unprecedented moment, as we all know. That term has been used a number of times, holds true, and Rhode Island is really responding in an unprecedented way. I'm personally humbled by the amount of coordination and work that has happened throughout the state to get this life-saving vaccine into the arms of the people on the front lines. Make no mistake about it, today, this week, is a historic moment towards getting to the end of the pandemic. We have a lot of work ahead of us to make sure that we get the vaccine out to Rhode Islanders quickly and in an equitable manner, especially as more vaccine comes into the state. I'm going to give a few updates on that in a second. But if our state was a runner, and this was a track race, right, I would say that we got a fantastic push off the starting blocks these first 4 or 5 days. The teams at Care New England and Lifespan deserve a lot of credit, and I really want to acknowledge them. I want to thank again my healthcare colleagues on the front lines for their dedication and work. I know that these times continue to be really tough. I also want to thank my colleagues throughout state government, here in the Department of Health and throughout the rest of government. Many people, more people than I can name here, work through nights and weekends and continue to do so to get us to a place where we are. You all deserve a huge thanks, so thank you if you're listening. To give you a sense of where things stand, to date we have 9,750 doses of vaccine that have been received by the state of Rhode Island, so 9,750. Approximately 2,000 doses have gone to Rhode Island Hospital. Merriam Hospital and Newport Hospital have each received roughly 1,000 doses. Approximately 2,000 doses have gone to 2 Care New England hospitals, 1,000 to Kent Hospital, 1,000 to Women and Infants Hospital. The rest of the vaccines have gone to South County, Landmark, Roger Williams Hospital, and Fatima. Also, some of our other partners have received vaccine as well, and this includes Westerly and Eleanor Slater yesterday and today. So we're thrilled that all the hospitals in the state have been starting to vaccinate. Again, I really do believe this is the beginning of the end of the pandemic. I do want to highlight that the Department of Health ourselves are not giving out the vaccine. We left this to the hospitals. We don't have staff at the Department of Health. The hospitals are stepping up in these early stages, and we'll be setting up more sites, as I'm going to talk about in a second. To date, approximately 1,226 frontline healthcare workers, as of this morning, have received first doses at these hospital facilities. Thankfully, our shipments yesterday, which accounted for half of the 9,750 doses we received this week, were not affected by the storm. And I think that's an important point as we think about the number, 1,200-ish, who have been vaccinated, is that half the doses just got into our state yesterday. So something to keep in mind as we work through the logistics here. For the week starting December 21st, we expect to receive 6,825 doses of the Pfizer vaccine. We'll talk a little bit more about that in a moment. Also this week, if the Moderna vaccine is deemed safe during its federal safety review process, which is ongoing as we speak, another landmark in the vaccine development, we expect to start receiving doses of that vaccine next week. We're anticipating approximately 19,000 doses of the Moderna vaccine next week, should all the safety approval process be reviewed and approved. In terms of our priority populations, right now we are slated to start vaccinating in nursing homes on December 28th. December 28th. As I mentioned last week, CVS and Walgreens entered into a partnership with the federal government to vaccinate staff and residents in all of Rhode Island's nursing homes. This is a priority population, as the governor mentioned. This setting has been incredibly hard hit by the pandemic, and so we're excited that they can be part of our efforts here as part of Phase 1A. This agreement between CVS, Walgreens, and the federal government requires us, before we start vaccinating in that setting, to have enough vaccine to allocate. And so that will happen by December 28th is when we start that vaccination project. So this is happening quickly and efficiently in facilities without us having to start and stop, et cetera. In Rhode Island, we also know to have a very high percentage of our population living in nursing homes, so it's going to take us a few extra days to get the vaccine needed to start. And this is compared to some other states which may be starting a few days earlier. Rhode Island is going to take a few more days to get up to speed to be able to vaccinate our populations. But the good news is that the residents and workers in nursing homes should all have their first doses within 3 weeks of us starting. So it's exciting, mid-January, which is right around the corner. Vaccination is slated to arrive at assisting living facilities and group homes, and that will begin shortly after the nursing home effort. Something else we're planning that I just wanted to talk about for a few minutes are 5 regional clinics throughout the state that will be opening up in the near future for EMS workers, for home health workers, hospice workers, and as soon as we have enough vaccine and our municipal partners are able to do so, other first responders. So this is a high priority for us. It's coming. The clinics are tentatively scheduled to start the week of the 28th. So December 28th, we expect to open these 5 regional clinics. So thank you again, everyone, for your patience. We're getting a lot of questions, which is fantastic. A little bit longer, and we'll be able to start. And finally, I do want to mention that we're doing we're going to begin vaccinating staff at federally qualified health centers and people who live in Central Falls specifically. This is because of the very high rates of COVID-19 in the community. We've seen that for months. We want to get this vaccine out to communities that are most in need of it. Importantly, we're still finalizing our final phasing plan for who will get vaccinated, where, and by whom. We plan to share this as soon as it is ready, and we'll continue to provide you with updates and reasons why, and the information that influences these decisions. And so this information includes other COVID vaccines. We're very hopeful that new vaccines will be approved that will come in the near future. We know that AstraZeneca has one in development. We know that Johnson & Johnson. So we're very optimistic that other vaccines will be here in the very near future. We also know that our amounts of vaccines supplied to us by the federal government can change. So these are all factors that are rapidly evolving, and we again thank everyone for their patience. A couple last points here. We've received a tremendous number of calls and emails over the last few days here at the Department of Health asking to get on a wait list to be vaccinated. So thank you again all for reaching out. That's what we're here for. We are approaching this in a structured way with a focus on getting vaccine to people who are most at risk, and we've talked a little bit about those populations. As more vaccine becomes available, we will be making announcements daily, weekly if needed, about who and where people can get vaccinated. So stay tuned, check our website, pay attention to these press conferences. We'll be announcing some of that in the near future. We know that people are very eager to get vaccinated, and by the way, I'm very optimistic and I love the demand that we've seen for the vaccine. This is fantastic. This is what we want from public health. As a physician, it makes me super excited. So thank you, everyone, for your patience. A little bit longer here. We're working as quickly as we can. And on that end, and as we tell ourselves that we need to be patient too, many of you saw in the news yesterday that our weekly allotment of Pfizer vaccine for the next week is going to be several thousand doses smaller than what we anticipated. So obviously somewhat disappointing. We're not sure of the exact reason for this. Many other states also saw their weekly allotment reduced. We are in constant contact with our federal partners at the national level to get a better understanding of the situation, and we don't have any answers about the why at this time. In the meantime, we're doing what we've done throughout the pandemic, which is what all of you have also done. We're adapting, we're being nimble and flexible, and adjusting to circumstances as they change. And as everyone knows, that's really been one of the themes of this pandemic. In closing, and I just want to go back to my running analogy, the pandemic has truly been a marathon. I think that we would all agree with that. And I think we still have a little bit of ways to go, but I remain optimistic that there is a light at the end of the tunnels. I believe these vaccines are going to come. As the governor presented today, it appears things have stabilized. This is good news with the vaccine. Hopefully this is one big step closer to the end of the pandemic. I'm also reminded that for marathons, the toughest time of a marathon is really at the end. So I think we're getting there. I know it's challenging for everyone out there. Thank you again for your patience and diligence. We're getting through it together. And I know this continues to be a tough time for so many people. So thank you again.